ThePrint. I am Sumi Sukanya Datta, and you are watching Health New. India, as you know, is seeing an exponential rise of cardiovascular conditions, particularly coronary artery disease, and poor lifestyle, which includes dietary patterns, lack of physical activity, and probably genetic makeup, are to blame. But now researchers at the All India Institute of Medical Sciences and the George Institute of Global Health have started this very special project where they are testing after developing the Indian, what they are calling is Indian adapted Mediterranean diet, which is very low in dietary inflammatory index. To discuss everything about this project and how exactly do they think will help the larger number of people, we have with us Dr. Ambuj Roy and Dr. Suparna Ghosh Jerath. Dr. Ambuj Roy is Professor of Cardiology with All India Institute of Medical Sciences, and Dr. Ghosh is a nutrition scientist from George Institute. Thank you so much, Dr. Ghosh and Dr. Ambuj, for joining us in the chat today. Dr. Roy, I must mention, is with the All India Institute of Medical Sciences. He's a professor of cardiology there. And Dr. Ghosh is food nutrition scientist with George Institute of Global Health in Delhi. Thank you so much, Dr. Roy and Ms. Cherath, for joining us. So, Dr. Roy, as I mentioned earlier, CAD or coronary artery disease affects a large number of Indians. Can you first tell us a little about this disease? Which are the kind of people who have it, and what a role does diet have to play in this condition?
Thank you, Sumi, for having me over, and it's a pleasure to be on your program. As you rightly said, coronary artery disease, or what is commonly known as heart attacks and blockages of the arteries to the heart, where you require an angioplasty or bypass surgery, is on the rise. We have the unfortunate name of being the capital of coronary artery disease of the world, because not only because of the large number of cases, but because many of them happen very prematurely, right in the prime of life of people. And if you look at the premature coronary artery disease, that is those occurring at an early age, is almost twice as much in the Indian population or the South Asian population, which we share a common genetic pool, as compared to the Western population. So many risk factors, as you rightly said, do contribute, and I think it's both nature and, very importantly, nurture that determines our propensity to develop coronary artery disease. So in terms of lifestyle, we, as you mentioned, we're very physically inactive as a population, leading to things like obesity, hypertension, diabetes, which all are forerunners to coronary artery disease. Again, our diets, although we largely are vegetarian diets, if you look at the large surveys from done across the country, whether it be by mostly by the NI in Hyderabad, we see that all the good things in the diet, which are cardioprotective, are much lower in terms of consumption. So that whether it be fruits and vegetables, whether it be legumes, whether it be the good oils, like the unsaturated fatty acids, they're much lower than what is recommended. So I think diet and physical inactivity plays a huge role in contributing to the current epidemic of coronary artery disease.
Yeah. Thank you so much for your views, sir. Dr. Suparna, can you tell us about Mediterranean diet and the diet that we follow typically in India? How is it different from what you're trying to introduce through this uh, research?
Yeah, so Mediterranean diet, if you ask me, is more a part of a lifestyle which the people living in that part of the globe follow. And it is more like what they eat, what is their lifestyle, how they use different combinations of the ingredients to prepare their food, and basically focuses on a plant based diet, more wholesome nutrition, and going by their traditional methods of cooking and stuffs like that. And how it is different? Well, I would say Indian diet inherently are anti-inflammatory, like the whole spices and condiments which our parents or our grandparents used, or the whole cereals that were consumed straight out of the field, the pulses which were consumed whole rather than polished, and a lot of green leafy vegetables which were growing in our backyard. But with nutrition transition, what has happened, and with globalization and urbanization, what has happened is several foods are penetrating into our food systems which were not traditional, which are have become more aspirational because they're coming from across the globe. And there the processed food and the ultra processed food are taking the place of several foods, traditional foods and ingredients, which are sometimes minimally processed, and hence to make them consumable we are spending a lot of time in pre-processing them and preparing them. So with convenience, people are more inclined towards consuming these ultra processed and processed foods which are coming from across the globe as well as produced in India. So that has led to a nutrition transition. So the traditional methods of cooking, the traditional food ingredients are more and more getting substituted by refined foods, refined cereals, pulses, and sometimes several of these polishing and other things which are happening at the industrial level are making these foods more aspirational. So,
Yeah.
if we talk about the origin of Indian diet, well, they have several ingredients which are similar to Mediterranean diet. And while matching the ingredients, we just saw only a few food items from the Mediterranean diets had to be replaced with the Indian counterparts. But most of the foods are now there and are already a part of our natural food systems, like the nuts, oil seeds, green leafy vegetables, and other plant based foods, and lean meat also.
Yeah, so it's more about going back to the roots, what we
Absolutely.
used to consume probably few decades earlier. Dr. Ambuj, can you now talk, because you mentioned about how some people with CAD have to undergo some procedures eventually. So once they have these events, cardiovascular events, they are put on restricted diets by, doctors and their caregivers. So what is the general pattern of diet that they follow, and what do you think are the probably the mistakes that they may be making and they shouldn't be doing that?
Yeah, it's a very relevant question. I will not blame the patients because it's mostly the doctors who direct them to those diets. And why should I blame anybody? I myself, in my early years, you're not so much trained for diet, and the typical response in a clinic when the patient, I think the most frequent question a patient asks the doctor, especially in India, after a procedure or after being diagnosed with heart disease, is what should I eat? And by virtue of our training, which is very much driven also by our Western literature that we read, we completely restrict them on oils. Then the first thing you say, oil, don't eat oil. And this is what we realized when we started taking these patients on in the study, that they were over restricted in a lot of food items, especially related to oils. So you have to realize, as I was talking earlier about the diet patterns in India, we are not heavy consumers of oil and fats. Our diets are overly uh, carb rich, and we have far more carbs that we need to take. And then when you restrict your oils, what are you doing? You're basically increasing the other constituent, which most often falls to carbs. So you probably in our setup making them worse in some ways. So what we need to emphasize is that it's not the oil which is bad or the carb. We have to get away from this monolithic approach of fat or oil, fat or carbs or this thing, but we need to have a more wholesome approach. There are good fats, there are bad fats, there are good carbs, there are bad carbs. So you have to realize that you need to be taking the right constituents. So the good fats like
Mhm.
plant-based oils, olive oil or canola oil, or typically in Indian use mustard oil is a very good source of the right type of oil that you could use. You need to increase typically fruits and vegetables in your diet. We are very low, especially whatever fruit, vegetables that we cook them to death. So we need to cook our vegetables in the right way, and that's what we've done in the recipes that we created. So that is the other thing, and then more and more whole grains rather than white rice. is what we need to talk about. Increase legumes in our diet. So it cannot be very monochromic, if I can say, approach. Your has to be getting the right constituents on your plate, and that is how we should approach. And that's what we did, creating these recipes. And as you would probably know, we've created a website also where the initial recipes that we've made are there for the good of the patients.
Yeah, thank you so much for those insights. Dr. Suparna, you mentioned about it earlier in your previous response, but can you please name for the benefit of our viewers, lay down some anti-inflammatory food items in Indian context, probably, which people can adopt in order to ensure their cardiovascular health or cardioprotective diet in the long run?
Sure. So I'll go food group wise. Said and done, Indians eat a cereal. It starts with, what is the first thing on your plate? It is your cereal. So the amount of cereal has to go down because it's the major contributor of carbohydrates. But in the cereal also, we need to select whole cereals, whole pulses, millets. Whole cereals means maybe going for a little less polished rice or hand pounded rice, brown rice, and millets could be ragi, jawar, bajra. And this is very cultural. Some of the cultures use bajra during the winter seasons. So go back to those practices. Then comes pulses. So the polished pink pulse, which is the masoor dal, may be little browner, but then consume the unpolished dals and whole dals, legumes and beans, for example, rajma, lobia, soya bean, and stuffs like that. Then moving on to vegetables and fruits, of course, all green leafy vegetables are good. But in the Mediterranean diet, they are specifically talking about cabbage and those specific vegetables, broccoli, cabbage, and stuff. So let's get similar counterparts. So in our study, also we looked at the taxonomic classification of those vegetables and got the equivalents. Then in fruits, it's berries, vitamin C rich foods, and the colorful fruits, simple things. Anything which is colorful has phytochemicals and other things like anthocyanin. Tomatoes get their red color from lycopene. So make your plate look colorful through these fruits and vegetables. So berries, citrus fruits, and stuffs. Then comes nuts. That's a very important, and the seeds. Now, people have been promoting these foods as a little, giving a little fancy connotation to it, if I may say so, like sunflower seed, flax seeds, and all. But also speaking from the Mediterranean perspective, of course, the flax seeds, that is called alsi, and the til, which is sesame. Now, several states, like northeastern states, use black sesame for preparing recipes. So simply go back to your original recipe, have those, and then comes the nuts, all the nuts. And you know when Diwali comes, people are gifting nuts to each other and all. Somewhere it has a healthy connotation at the end of the day, that you have almonds, you have a little bit of pistachio, walnuts have very good fats. So, including them. And if not that, even groundnuts will have healthy oils added. And apart from that, the kind of oil that you're consuming. So, olive oil, we might say that it's a little expensive. So, and we need to develop a taste for it. So, use olive oil maybe to drizzle your salad, or, you're eating something, just pour a little bit of olive oil. You're making a jhal muri, for example. That's a very traditional dish using murmura vegetables and all. Instead of mustard oil, put a little bit of olive oil. And go for your mustard oil, which is a traditional oil. Rice bran oil is quite popular in India now, and you can have rice bran oil as well as peanut oil. So keep changing the oil, but yes, certain oils have effects which are protective, so use those oils. I think I've covered most, but avoid refined sugar, avoid refined carbs. Like Dr. Ambu just pointed out, you just have to play around with the kind of carb you're having, the kind of fat you're having, and having the source, identifying the best source of the good nutrient from these foods. And that's going to help. And the last thing is avoid ultra processed foods. Anything that you cannot prepare in your kitchen has been processed to the core, and the natural ingredients are lost during the process. So, those with additives, preservatives have to be avoided. Thank you.
Very useful information there. Dr. Amboj, like you mentioned earlier, many doctors actually don't really emphasize enough on the nutrition part of a patient's journey through the before the disease as well as after the disease. In India's medicine, how patients are treated, do you think that especially as we see the rise of non communicable diseases, there is a need to talk and emphasize a lot more on nutrition than probably it is done right now?
Yeah, obviously, we need to do that, and most doctors, unfortunately, are have their own specializations and don't get typically trained on nutrition, and because it is a completely different stream, and I think we that kind of training is extremely important even within the our own community, to understand that diet can play a major role in several non-communicable diseases, cardiovascular disease included. Uh, so that is obviously a need of the hour, but how do you get it? So we need to use newer technologies, I feel, and we need
Mm-hmm.
to create awareness and use, for example, digital platforms where we can create the right recipes and try to disseminate it as much as possible, which could be educational for doctors and for the patients. So that is the need of the hour. And I completely agree with what all Suparna said. I would just add, that during the course of this and the developing the anti-inflammatory diet, which you said, one of the very important constituents which probably people don't realize is the herbs and spices that we
Yeah.
use, which I also didn't give so much merit to. But we realized there's a very objective way now called the Diet Inflammatory Index, which you can measure the anti-inflammatory score of your diet. And one of the very important constituents are the herbs and spices, which have been traditionally used and probably for which we were colonized. Actually, if you see this, the Europeans came for the spices initially. Maybe they knew the worth of those in many ways. Things like turmeric, cumin, jeera, coriander, cardamom, cloves, and those kind of things, and herbs like curry leaves, which are very so commonly used, mint, coriander, uh, basil. So these have very strong anti-inflammatory. So if you just add on to your diet, and which is traditionally the way we cook, then it brings on a lot of anti-inflammatory uh, good to your diet. So that's something which we have also very much emphasized in our the diet which we developed.
Yeah. Dr. Suparna, now will you talk a little about this particular project that your institute in collaboration with the AIIMS is doing at the moment, and how exactly has this 7-day diet plan been developed, and what exactly are the main ingredients that you are offering to patients and others?
Okay, so basically, we developed the intervention, and it took us a year's time to develop this complete intervention in the sense the food, the dietary regime part of it mostly. So, the first work, the initial work was to just look at the literature and have a kind of a free list of food items that are offered as a part of Mediterranean diet, and then exploring those food items and kind of matching them with what all ingredients are already consumed by Indian population. And as Dr. Ambu just rightly pointed out, the herbs, spices, turmeric, and the whole spices, clove, cinnamon, cardamom, all are so widely documented in these diets, and especially as anti-inflammatory food. So Mediterranean diet was a starting point, but soon we realized that our own Indian foods are so anti-inflammatory and are so well documented that they are all culminated into the DII scoring system, where they are talking about all these herbs, spices, whole cereals, pulses, nuts, fruits, and vegetables. Coming back to the project, so we sort of did an extensive review of literature and then first curated a list of food items that should go into this anti inflammatory diet. The next step was to develop North Indian recipes, what people usually consume. We cannot make a fancy cookbook and ask a person from a middle or a low socioeconomic group or community to come and prepare those exotic dishes. So we went as I would say, as basic as possible with our recipes, like normal dal with a tadka, or or it's simply just having haldi wala doodh, which is also a part of a anti-inflammatory thing. When somebody gets a bone pain or some aches and pains, haldi wala doodh is given traditionally.
Can I
So
can I please interrupt there, since you mentioned about haldi wala doodh? Now there has been a lot of debate about that. That
that is
bioavailability of turmeric is very low, and when you have it with milk, it just gets washed out from the body. Doesn't
washed
really
out.
benefit. Can you please clear it for our viewers?
And another thing is, how pure is your turmeric? That is
Okay.
another. Metanil
Mhm.
yellow is
So
present in
purity is something
turmeric.
that we can't control.
We
Everything that
can't
we
control.
consume these days is probably not pure. So
Yeah.
that's
So
a big challenge.
okay,
Yes.
but the research in anti-inflammatory property of haldi, because haldi has several other bioactive components present in it, the phytochemicals which are present in it, which sort of adds on to the anti-inflammatory nature of this. Now, the interaction between these bioactive component and the calcium present in the milk, I'm not sure whether that actually inhibits the absorption of bioactivity of these ingredients, but I would rather go with incorporating haldi into your recipes the way we used to do. What our grandmothers used to do is important. But to answer that specific question, whether calcium leads to malabsorption of the bioactive components, I'm not sure all the bioactive components have been looked at and seen with the, that calcium bioactive interaction has been.
Those interactions have not been probably studied.
It is not so well researched, rather than it could be an anecdotal kind of a belief. Coming back to turmeric, people are also eating a lot of raw turmeric as the the it's a
Yeah,
root,
yeah.
it's a tuber,
Especially
it's
during
a
the
tuber.
winters, a lot of people consume
Yes.
raw turmeric.
So, that way, we can increase the availability, not going for the ground spice, but going with the origin of that spice, which is healthy. Coming back to our recipes, so we use lots of traditional recipes, normal pohas and other things, which we anyway cook, but we are supplementing it with a little bit of sprout, some nuts, wherever there is an availability, or maybe a salad, we will just add a bit of flaxseed to the salad. So just modifying the basic recipes was our way of doing it. Then we followed a structured method of having a calorie calculation based on the food groups, which we dietitians do often do. And based on that calorie specific diet charts, we made a recipe book. And for a particular diet prescription, that you have this much of cereal pulses and all, people cannot translate that into a diet. So we gave exact amounts of a recipe for 5 people, because we consider that the diet has to be modified for the family and not for the patient. So we gave a recipe of 5 people, 4 people, and we said this much of katori, and simple measures like cups, katoris, karchi, which are very local and very household. So we tried to customize things, but within the knowledge, or within the understanding of the community to whom we are prescribing this diet. And the counseling, and I just go back to your question, doctors, well, doctors are doing their duties and they have several other things to do. It is a multisectoral approach which is important in any disease management. We cannot ignore the skill the nurse has, the skill the dietitian has. And of course, digital technology is there, and these are our tools. But the human touch will come when a multisectoral team works together and administers these regimes to address a chronic disease. And India being the capital of some of the several chronic diseases, I think the approach that AIIMS has taken to engage with the dietetics and nutrition to curate a model of intervention where a multisectoral team of a biochemist, a nutritionist, a cardiologist, and food scientist are working together. I think that needs to be, utilized. That kind of a model needs to be utilized if we have to address the epidemic of non-communicable diseases that we are facing right now. Yeah.
Yeah. Thank
So
you so much for
basically,
that
the diet
answer.
was developed, the calorie chart was developed, and those calorie charts were complemented with a book and the website which Dr. Ambuj is mentioning about, which is so user friendly. You can have the website in your phone and you can just scan through the recipes, or you look at the recipe book, a family counseling. So the entire intervention was curated. Then we looked at the feasibility of the intervention. We tested it on a sample of patients, followed them for 6 months, and saw whether they were able to change their diet to 20%, 40%, 60%, or 100%, And after making sure that they are able to change their diet to some extent, we developed all the tools and processes of a research, a randomized controlled trial. All those were developed, and now we have initiated the trial at the All India Institute of Medical Sciences with very sound principles of a randomized controlled trial being implemented right now. Thank
Yeah,
you.
Dr. Ambuj can probably talk a little about this trial. I'll also take this opportunity because, we keep getting asked this question. So, what exactly is the risk factor, biggest risk factor you think is for these sudden deaths, particularly due to cardiovascular conditions which are undetected that we are seeing in India? And in some cases where this does happen, this unfortunate thing, what can people or the caregiver do?
So yes, sudden death is such a tragedy for the family, the near and dear ones. And unfortunately, it's on the rise. There may be some reporting bias because every sudden death in any corner of India is now on the social media and all WhatsApp group. But yes, as I mentioned, and there is a whole, I mean, there's lots of data that as ethnicity, South Asians are prone to cardiovascular diseases, coronary artery diseases, and the large majority of sudden deaths, which we've just finished a study where we did autopsy studies and molecular autopsy, where we looked at causes for sudden death. Almost half of them were because of coronary artery disease or heart attacks. A few were because of some genetic abnormalities that make you prone to sudden death, and then there were other causes. So obviously, this most important cause of sudden deaths are the increasing coronary artery disease and our susceptibility to it. So all the things that we need to do to prevent coronary artery disease, like good lifestyle, which we spoke about, diet, physical activity, maintaining the ideal body weight. Beyond a certain age, everybody like above 25 should get the very minimum blood tests, which is cholesterol, your sugars, and your blood pressure under control. And very importantly, people who have the coronary artery disease should be on certain minimum drugs which prevent recurrence of coronary, because somebody, if he has coronary disease, he's already been identified as a very high risk person. He needs to be on certain medicines like statins and aspirin for life. Unfortunately, that is also very undertreated. So these are the certain things which we need to do as a society, and that will help reduce this incidence. Some of these are like accidents; they will happen. How do we reduce is what we can do, and these are the measures. And I'm so happy that, as you would know, the ministry is now really after nutrition and obesity, and there's a lot of focus now on the chronic diseases, yeah, including the national program for NCDs. So thankfully now it's very much in the focus and will help reduce this public health burden.
Yeah. Can you briefly talk about this particular IAMD which is going on undergoing at the AIIMS as of now, and how many patients are being tested?
Yeah, so this is a clinical trial, a randomized trial where one of the arm will be getting the diet which we have developed, the Indian Mediterranean diet, and the other arm will get the usual care, which is by our normal dietetics, and we'll look at outcomes of change in the diet, change in the inflammatory markers, change in the markers of nutrition. We plan to recruit 140 odd patients. We've already done more than 115 patients now. We should be have the results in another year's time. But we really want to expand it further. Right now, as Suparna mentioned, we've focused on, since we're Delhi based, we focused on North Indian cuisines. Cuisines and culinary tastes in India change every 100 kilometers or so. So we want to do it on South Indian diets. We want to do it on Western Indian and Eastern Indian diets too. hopefully, as we go forward, we will engage with people from there and expand it to a pan India study and do a large clinical event, even trial at some point of time. But it's early days, and we're happy that we've been able to achieve this, at least for the North Indian cuisine, develop these diets. And thanks to you and media, it's caught on and it's getting widely disseminated, and that's hopefully it should be good for the people in general. Thank you.
Yeah. So tremendous work that you and your team and everybody at AIIMS and the George Institute is doing. And I hope that